for waiting, everybody.
Yeah, thank you. So my name is Michelle Joseph, and I'm the CEO of Unison, and I want to welcome you all here today, and thank you for taking the time to come out and celebrate the announcement of Edge OV. And I hope you guys will all return in the new year when we've done our renovations and changed the color and have our clinic up and running. I'd like to take this opportunity to say a few very brief thank yous. So first of all, I would like to thank the Oakwood-Vaughan Neighborhood Action Partnership. This is really their vision. They are a dedicated group of volunteer community members who have worked tirelessly to bring primary care to the Oakwood-Vaughan area. So I thank them for their passion, their dedication to improving the health of their community. I'd like to take this opportunity to thank Susan Fitzpatrick and her team at the Toronto Central LHIN, Minister Huskins and his team at the Ministry of Health and Long-Term Care, and Josh Coole and his team at the City of Toronto for their support and making this clinic a reality. And lastly, I would like to thank our service delivery partners, Planned Parenthood of Toronto and Davenport Perth Community Health Centre, whose skills and knowledge and expertise in providing barrier-free, accessible mental health and sexual health services to youth will ensure that Edge OV will be a success. So thank you. And with that, I would like to introduce the Minister of Health and Long-Term Care, Eric Hoskins.
Thank you, and it truly is, it's not only an honor, but extremely exciting to be here this afternoon. You know, this is one of those rare moments when I'm here, of course, as the Minister of Health and Long-Term Care for the province of Ontario, but I'm also the local MPP, and those of you from the community will know that this has been a labor of love. It has been a long time coming. I think one of the first efforts that was made when I became an MPP for St. Paul's 8 years ago was to begin that exploration of how we could bring healthcare to Oakwood Village, to the Oakwood-Vaughan community, that we have clear evidence demonstrating not only does this part of Toronto have a high prevalence of, for example, diabetes and high blood pressure compared to other parts of Toronto, but it's also fairly dramatically underserved in terms of access to health services. So it's great to finally make it to this day, and I have to, and there have been so many people that have been involved in this process, but it's so exciting to be here in a building that has gone through many changes already. I think it was the CIBC originally, and then Courtney Betty had his law office in here for a while, and I'm not sure who was responsible for the paint job, but it is a wonderful premise at a beautiful location, right where the 5 streets come together at Oakwood and Vaughan, and it will serve this community so well. So good afternoon, and thank you everyone for joining us today again for this exciting announcement. It gives me great pleasure to be here today to celebrate an important step forward in the delivery of health care for everyone in this vibrant community. Located, as I mentioned, in the riding of St. Paul's, a community that I have been proud to advocate for and represent as MPP. Now, when it comes to health care, every patient wants to know one simple thing. Is the health care that I need going to be available when and where I need it? Our government's been working hard to try and ensure that everyone has access to health care services, the services that they need, and as close to home as possible. This commitment, quite frankly, is at the heart of our Patients First action plan for health. We're committed to ensuring that everyone in Ontario has access to a doctor, a nurse practitioner, or another primary care provider when they need one. And if that patient needs to see another health care provider, that they are connected quickly and seamlessly. That's why our government has invested in creating interprofessional healthcare teams, where your primary care provider, your doctor or your nurse practitioner, works in unison, no pun intended, with other professionals such as dietitians, mental health counselors, and physiotherapists. So we're building a healthcare system where your doctor or nurse practitioner is able to connect you right away to the healthcare provider that you need. And then hopefully that healthcare provider will be just down the hall. So today we're taking a big step forward towards realizing that kind of healthcare system right here in the Oakwood-Vaughan community. So I'm here to announce today that our government is investing approximately $600,000 in capital and nearly $1 million in operating funds annually going forward to help Unison Health and Community Services build a satellite clinic right here in the Oakwood-Vaughan community. And ladies and gentlemen, this new clinic will expand interprofessional care in this community and provide the residents of Oakwood Village and the surrounding area with the services they need. It's going to help nearly 1,000 people with high needs in this community access regular care from a doctor, from a nurse practitioner, a registered nurse, a social worker, and a health promoter. And it's going to focus on providing services to people living in poverty, isolated seniors, vulnerable youth, non-insured patients, and people living with complex mental health issues. It's going to provide the preventive care and the social supports that those individuals need. And we're going to do it right here, right in this building. So I want to again thank the leadership and the board at Unison Health and Community Services for their vision and their strong commitment to this project. Not just to this project, but to the people and the community that we together serve. But I'd also particularly like to mention and make special mention of the Oakwood-Vaughan Neighborhood Action Partnership and all its group members who have committed themselves to improving the quality of life in this community. Bill Worrell, Sue Snade, Liba Spring, and many others have worked hard over the last few years to bring together local residents, businesses, and city staff to develop an Oakwood-Vaughan strategy to improve the economic development and social services available here. You've repeatedly demonstrated not only, obviously, your perseverance, but your dedication to highlighting local needs. And today's announcement really, quite frankly, is a response to your appeal for action. And I'd also, as was mentioned before, like to thank the Toronto Central LHIN, CEO Susan Fitzpatrick particularly, for her and their hard work in recognizing the specific healthcare demands of this area of Toronto and ensuring that they're accessible. Finally, before I introduce our next speaker, I'd like to express how happy I am that he is here today. Thank you to my friend and colleague, City Councillor Josh Cole, for joining us here today. His efforts, his hard work, and his entirely positive attitude on behalf of residents, especially here in the Oakwood-Vaughan community, together they have a lot to do with why we're here today. So thank you, Josh. I appreciate all the work you've done for this community and really to help make today's announcement possible. So again, today's investment of approximately $600,000 for capital improvements, and you'll see, a few improvements are required, and I'm assured they're going to be done quickly, but nearly $1 million in annual operating funds. This investment today demonstrates our government's commitment to increasing access to interprofessional primary care services. But I would be remiss if I didn't go back to the beginning and state just how proud I am of the hard work that this community has done to realize this dream. And a dream which has its foundation in a real need, a need that is, I believe, and with confidence being addressed with today's announcement and the important work coming forward by Unison. Thank you very much.
I guess that means I'm up. Thank you very much, Minister Hoskins, and thank you for the kind words. But more than anything, thanks for the investment in this community. When I was first elected, and one of the reasons I actually ran for office living in this neighborhood was because there had been a steady trend of resources and services leaving Oakwood Village and leaving Oakwood-Vaughan. And so the community spoke clearly and said we need to have resources and services and organizations come back to this neighborhood to serve the community. And first upon being elected, some of the work we did was to survey residents, to ask residents, what services do you need? What do you need? And the top of the list came two items all the time. One was arts and youth-based arts programming, which the great news is that's coming across the street with NIA Center for the Arts coming to Oakwood-Vaughan. The second one that was always on the top of the list, either 1 or 1A, was community health services. We heard it time and time again, to the point where the Residents Association at the time actually convinced public health to provide data to make their case for them so they could lobby both me and Minister Hoskins to demonstrate how acute the need was. And so we've been hearing that for such a long time. And And so I'm so thrilled that it's finally happening. And certainly want to thank Minister Hoskins, not only for his work locally, but as Minister of Health, to recognize how important local frontline community health services are to the overall broader health of a community in one like Oakwood Village. It's interesting to note that this building where we stand right now, at some points in its history, has been a bank, it's been a law office, it's been other things, and now it's going to kind of reinvent itself again as such a great community asset. I also want to just say that as services return to Oakwood Village or to Oakwood-Vaughan, you can start to see what the future is going to look like. And you think there's going to be an arts center across the street, a health center here where we stand, of course a subway station now that's coming right to Oakwood and Eglinton. And you see the building blocks that are now here and available in this community that's going to realize the dream and the vision that people like in the Oakwood Village Neighborhood Action Partnership, and before them, the Oakwood Village Community Association, had worked so long and hard to deliver. I want to make one mention specifically of Unison. Unison, of course, offers services in another part of my ward in Lawrence Heights. And so I've seen firsthand how important having a physical structure like this in a community is, and the services that go along with it. Many people who need to use the system, they come into the first front door that's available to them, and one that's as welcoming as Unison is so valuable and powerful in changing people's lives that someone who might come in here for any number of reasons are now triaged, and they're entered into the system and get the help and services they need. And I've seen it in Lawrence Heights time and time again, where that Unison hub or center has become such a focal point of the community. And it means more than just the health services they offer locally, and it's really become something that they embrace and love really in that community. And I know that Unison being here and the center being here will provide that in Oakwood Village. So I'm so grateful to the community members who for so long have advocated for this. Of course, for Minister Hoskins for advocating for not only this, but the return of so many services into Oakwood Village, and for him helping us to realize the dream of what this neighborhood can be and could be. And I think we're starting to see these building blocks come into place and that vision come into reality. So thank you again. Thank you for everyone for being here. And I look forward to seeing the work that's going to be done out of this intersection and this location. So thank you.
So in closing, again, I just want to thank everybody for coming out today, and I'm really excited about this project. And again, we want to encourage you, what you'll be hearing from us in the new year, and we want you to come out and see when we've done all our work and we're up and running. And so in closing, I guess I would like to invite the media and Mr. Hoskins to the side. To the side.
Yeah, it doesn't matter.
To the side for any Q&A. Okay, so thank you very much.